Holyoke Medical Center. Experience the new standard in patient care.
I'm a roadie lighting technician. If I'm not working, I don't eat. I was a 5-pack-a-day smoker. I mean, I've been going to doctors for COPD for years. The hospital should come into the room. She just said, you can fix this. If it wasn't for Holyoke Medical Center, I wouldn't be going on tour with the Stones this fall. You just felt like someone cared.
People come into the hospital and they don't know what to expect. This may be their first time ever in a hospital. They're being admitted to the hospital and they're completely freaked out.
So when a patient comes into our emergency room at Holyoke Medical Center, it's important for us to explain every step along the way what is going to happen to them and why we're doing what we're doing, and then what the results of what we're doing are. And the family appreciates that, the patients appreciate that, and it really does alleviate a lot of their fears and concerns, and then provides confidence in them, with the care that we're delivering.
The patients feel comfortable when they come in here too, because everybody knows each other and everybody trusts each other.
The American College of Radiology has accredited Holyoke Medical Center for magnetic resonance imaging and breast magnetic resonance imaging, ultrasound and breast ultrasound, computed tomography, stereotactic breast biopsy, and as a breast imaging center of excellence.
We work as a multidisciplinary team in the intensive care unit, so every day we'll round. We'll round with a nutritionist, a pharmacist, a nurse, respiratory therapist. Families are invited to attend those rounds with us. Most of the time they get lost in the medical jargon, so usually what happens is right after rounds, I'll go talk to the patient's family about, listen, we just had rounds with our team, and this is what's going on. I
love the fact that it's a community hospital. I love the fact that the x-ray techs and the lab techs and the people that, work in environmental services by first name. You know everybody by first name. You work in big hospitals and you don't get that kind of atmosphere.
Caring is key to being a good physician. It's key to being a good nurse.
Personal care means to me exactly what we do here.
Holyoke Medical Center has been accredited by DNVGL for quality and patient safety. The Intersocietal Accreditation Committee for Vascular Testing has received the American Stroke Association's Gold Plus Achievement Award, accreditation with commendation from the Commission on Cancer of the American College of Surgeons, and accreditation from the College of American Pathologists.
I've always looked at my patients and cared for my patients with the thought that that could be my mother or that could be my grandmother. And I've always treated them as if, they were mine, and I treated them how I would want my family to be treated. I love being a nurse.
Actually heard people as we've been discharging them out of the hospital. They love the fact that they've been treated as a real person, an identity, not just a number.
En el Holyoke Medical Center, los pacientes entran como pacientes, pero salen como familia.
At Holyoke Medical Center, we don't work on patients, we work with patients and their families to give them the care that they need and they deserve.
It makes you feel really good when they leave here, feeling as good as they do. It makes you know you did your job well.
A lot of patients, come in as patients and wind up leaving as friends because that's how we make them feel.
And you take pride in that.
At Holyoke Medical Center, our emergency department responds to the needs of more than 45,000 visitors each year.
Time is of the essence with any patient with a stroke. I had a 20-year-old patient that came in. She was unable to speak. She was unable to move her right side. We brought her into our emergency room, and within no time, she was able to speak again, move again, and within 2 weeks, she was back at school, playing soccer, studying, and to this day, she is still doing great.
Holyoke Medical Center was the first hospital in Western Massachusetts to successfully complete the National Accreditation Program for breast centers.
they are really surprised at the care they've received here, and they say, I love Holyoke Medical Center. And I just tell them to make sure they tell all their friends.
Holyoke Medical Center met all my expectations, exceeded all my expectations.
We just felt constantly cared for. They were part of our family, and they were taking care of us like family.
I've got a gym right here, and there's just no reason for me to go anywhere else.
And I don't think I possibly could have felt more cared for than I did by everybody.
So I just want to say thank you, Holyoke Medical Center, for all that you did for me.
Cuando usted está en el hospital, usted necesita saber todo lo que está sucediendo. En Holyoke Medical Center tenemos intérpretes y más de 165 empleados bilingües que le mantienen informado. Y nuestro nuevo centro de diabetes es completamente bilingüe. No puedes ayudar a las personas si no puedes entenderlos. Nos preocupamos porque usted es nuestra comunidad.
Holyoke Medical Center. Experience the new standard in patient care.